Hello, everyone. Moist heat therapy is a type of heat therapy. By applying heat higher than body temperature to the local area of the body, it achieves antispasmodic, anti-inflammatory, analgesic, and swelling-reducing effects. Now, let's learn how to apply moist heat compresses. 1. Assessment. Evaluate the environment for cleanliness and appropriate temperature and humidity. Assess the elderly person, including their medical condition, consciousness level, and cooperation ability. Local assessment includes examining the elderly person's skin or wound condition. 2. Determine the care needs of the elderly. According to the assessment, the elderly person has localized pain, inflammation, swelling, etc. Local moist heat compresses should be applied to the elderly to relieve symptoms. 3. Planning. Apply localized hot and humid compresses to the elderly. 4. Implementation. Supplies needed include basin with 50 to 60 degrees Celsius hot water, hot water bag, large towel, treatment tray, 2 hemostats or large tweezers, 2 compresses. The size of the compress depends on the area to be treated. Gauze, petroleum jelly, disposable treatment towel. The caregiver should dress neatly, wash hands thoroughly. Once the supplies are ready, bring the supplies to the elderly person's bedside. Communicate with the elderly person and explain the procedure purpose and cooperation points. Assist the elderly person to expose the affected area. Place a treatment towel under the affected area. Then apply petroleum jelly around the affected area, covering an area larger than the hot compress site. Then cover with a layer of gauze. Immerse the compress in hot water. Remove the compress with hemostats or large tweezers and wring it out thoroughly. Wring until no water drips. Shake out the compress. The caregiver tests the temperature with the inner wrist. It should feel comfortably warm, not hot. Then place the compress flat on the affected area. Cover with a cotton pad as needed, and place a hot water bag wrapped in a large towel to maintain the effect of the hot compress. Change the compress every 3 to 5 minutes during the application. Overall duration of the hot compress is 15 to 20 minutes. During the procedure, if the elderly person feels the compress is too hot, lift one corner of the compress to help dissipate the heat. Continuously assess the elderly person's comfort and local skin condition during the procedure. Check for signs of skin redness, itching, or discomfort. If the skin is red and itchy, immediate intervention is required. After the hot compress, remove the compress. Dry the area gently. After completion, assist the elderly person to a comfortable position. Make up the bed unit. Pour out the water. Dispose of the compress in the medical waste bin. Record the site, duration, and effectiveness of the compress. Signature of the operator. 5. Evaluation. Mainly observe and inquire the elderly person. No discomfort environment is fresh and clean. Reasonable placement of objects. Correct handling. Precautions for moist heat compresses. 1. If pressure is not contraindicated on the hot compress area, place a hot water bag on top of the compress. Cover with a large towel. Can maintain the therapeutic temperature. 2. After completing the compress, do not dry the area by rubbing, as this may damage the skin. 3. If there is a wound at the compress site, the wound should be managed using a septic technique. 4. During the hot compress procedure, always ask. Observe the elderly person's comfort and local condition. If any abnormalities occur, handle them promptly. Avoid burns. 5. The duration of hot compress application should not exceed 30 minutes, to avoid secondary effects. That concludes our lesson on moist heat compress technique. Thank you, everyone.